Hello everyone. So let us study today about the mechanism of labor in breech presentation. Okay. So again, lie is longitudinal, presentation is podolic, presenting part is that is the breech. Then comes the denominator. Denominator is sacrum. Then attitude of the baby, it is well flexed attitude, and it is in frank breech. Okay, so they will ask the types of breech. So the types of breech are, see, when both the legs are completely extended, it is flank breech. Both the hands are flexed, and the legs are flexed and the knees are also flexed. This is complete breech. This is frank breech, and there can be kneeling, knee presentation, that is incomplete breech. There can be footling, and then this is about the different types of breech presentation. Here the attitude is frank breech, that is legs are flexed, hips are flexed and legs are extended. Okay, so that is the attitude. Then comes the denominator is sacrum, and the position I want to teach you is left sacro-anterior. Okay, so that is the left side, and then left sacro-anterior. Again, same engagement happens when the bitrochanteric diameter crosses the pelvic brim. So with the further descent and the further flexion, the breech comes down to the pelvic floor, and then breech will climb up the perineum. Engagement, descent, flexion. Afterwards, internal rotation happens. So whatever is there in the left sacro-anterior will come into direct sacro-anterior, right? So the left side, whatever was there, it will come into direct sacro-anterior. So then after internal rotation, there is climbing up of the perineum. It is not called croning. It is called climbing up of the perineum. When it is climbing up of the perineum, that is the time you will give episiotomy, right? So when the breech climbs up the perineum, then you can use femoropelvic rib. That is, only keep your hands over the bones. That is either in the hip bone, either in the superior iliac spine bone or in the sacrum. You will hold the baby. That is through femoropelvic group you will deliver the buttocks. So when you deliver the buttocks, the legs will come down, right? Either like this, or the legs are not coming down because of frank breech. What you can do is take your hand inside and press on the popliteal fossa, then press on the popliteal fossa, and then flex the leg and then take out the leg. Again same, go behind and press the popliteal fossa and then flex the leg and take it off. That is Pinard's maneuver. Okay, so now both the buttocks delivered. Then when both the buttocks delivered, either the baby can be in this position or in this position. So what you have to do is you have to rotate the baby so that the back comes anterior. Remember, back should come anterior. If back you cannot make it anterior, then if the front part comes anterior, you can damage the abdominal organs. When you press over the abdomen, you will damage the abdominal organs, plus umbilical cord will be exposed. So which you should not want, which you don't want. So back should be anterior, remember. Then when the head further descent and further flexion, then comes the shoulder delivery. Shoulder should come to lie in anterior posterior diameter, and then you can deliver the posterior shoulder if possible. Then comes the delivery of the anterior shoulder. This is how you will deliver. So but you can suspect the difficulty in shoulder when there is delivery of the back. See, when the back comes, the head, whatever the hand is there, this can go and keep the hand like this. This is called nuchal arm. When the baby do like this, the angle of the scapula, whatever is there, the distance between the angle of scapula will increase. As you do like this, there is abduction, right? So the angle of scapular distance is increased. By that you can suspect there is difficulty in delivering of the shoulder, right? So when there is difficulty in the delivering of the shoulder, what you can do is you can go into the parvagina and you can just deliver the posterior shoulder arm. Okay, it is actually easy. Delivering of the posterior shoulder arm is actually easy. You have the space in the posterior side, in the sacral promontory. So you can deliver the posterior shoulder arm, or they will even put a sling. and they will give sling traction and then deliver the posterior arm, or the whatever the old manner, that is love set manner, that is delivering the making the shoulder from anterior posterior diameter to the oblique diameter. So you want to make the shoulder from anterior posterior diameter to oblique diameter and rotate it by 180 degree, which makes one shoulder to come out, and then again rotate back to 180 degree and another shoulder will come out. That is called love set manner, and it is practically a little bit difficult to do. When after the shoulder delivery, so what should come is our head. So when the nape of the neck is visible, either you can do what is called burn Marshall manner, that is you do flexion of the head, and then here you have to use only these 3 fingers. Okay, so with these 3 fingers you will catch hold of the ankles, and then again you will make the baby to cross over the abdomen, so maternal abdomen. So complete flexion, suprapubic pressure you have to give so that the head delivers by flexion. Okay, so not too much of pressure you have to apply, not too much of forced rotation you should not do, because that will injure the cervical spine. Sorry, my pelvis and skulls are too tight, so that is now it's not coming, so that is why head delivers. Okay, or you can do something called Marisu smelly wheat technique. What is Marisu smelly wheat technique? See, whatever the baby which is delivered, hold it in your, so the baby which is delivered, hold it in your non-dominant hand. So okay, that is the end. From here you will give shoulder traction from these 3 fingers. So one finger over the right clavicle, another is over the right clavicle, and one is in the middle. So you will give shoulder traction from your dominant hand. You will give what? Here you will give shoulder traction, from down you will give malar flexion. Malar flexion is over the 2 maxilla and in this into the mouth. You should not make the mouth to move so rigorously, that will cause damage to the mouth of the baby. So this is malar flexion. You want to flex, malar flex. Here you will give shoulder extraction. So from there you will controlly you will extract the baby. That is Marisu smelly wheat technique. Okay. If with this manner also baby is not delivering, we have a forceps, that is Piper's forceps. So what is the difference between other forceps is, Piper forceps is not having pelvic curve, it is having only cephalic curve, because you want to deliver only after coming head of breech. So that's why it is having only cephalic curve, and the shank, whatever the shaft is there na, that is very long. Okay, that's how we can identify it as a Piper's forceps. Suppose you can't make the back anterior, if the back is posterior, then the method of way you deliver is called Prague maneuver. So this is about the mechanism of labor in breech presentation. Remember, breech mechanism has 3 types. One is spontaneous, assisted, or total breech extraction. Spontaneous is whole thing process occurs spontaneously. Assisted breech is up to the level of umbilicus, breech delivers by itself. You should not pull. No pull technique. If you pull now, it will cause head to extend. When it is hyper extended head, it is a contraindication for breech delivery. So we will not pull the baby. No pull technique has to be used. When the umbilicus is visible, you have to cover the baby with the warm towel for the better grip of the baby. Okay, that is the assisted breech delivery. Afterwards, only for shoulder and head delivery you will assist. Then comes total breech extraction. Total breech extraction is only done during LSCS. For a breech, we have to extract the baby. And the second thing is, after the first twin delivery, you want to expedite the delivery of the second twin. That time you will go for total breech extraction. This is the 3 mechanism of labor in case of breech presentation. Thank you. Like and share and subscribe.